David Ting. I moved to Vegas back in 2000, and since then I've been practicing clinical dentistry. We operate 15 offices here in Las Vegas. Traditional dental techniques are the fundamental pillars for digital technology. Knowing how to do dentistry efficiently and effectively via traditional method allows us to utilize digital technologies at will and anytime and however we want it to. We have this shiny Aoralscan 3. We have about 12 to 15 of them. We have the AccuFab L4D printer, wash, and FabCure. We also just recently acquired the MetiSmile. We have had so many intraoral scanners, almost every single brand out there. We love the shining Aoralscan 3 because number one, it is very small. It allows a practitioner, especially my assistant, to be able to manipulate and maneuver the machine via their fingers. It's a very durable machine. After multiple sterilization, the tip does not melt. It is very straightforward to use, especially the software. Anybody new to our office can be trained for 5 minutes and be ready to use the machine. I think most importantly, the shiny Aoral 3 is a very fast scanning machine. Typically, I spend about less than 2 minutes per arch, and that's on my day-to-day practice. Since we acquired the Aoralscan 3, we routinely make intraoral scan part of our exam process. Our assistant now across 15 offices can be very easily trained and pick up the scanning in every office they go to. The fact that it's scanned through shining surfaces, for those of you who does scanning, you know what I'm talking about. Scanning through shining surfaces is really a plus for this unit. Patients are very often amazed as we are scanning them. The monitor right across from them shows the scanning process. All of them are impressed with the technology we're utilizing in dental office nowadays. So the console report is a very unique feature for Shining 3D. It really helps us in explaining all the potential pathology that we see in patient's mouth. That is, after we scan the patient, there's a QR code generated, and patient can simply, by clicking on that QR code, and see exactly what we see on the scanning images. And they are really amazed to see that. MetiSmile is a super facial scanner that every dentist in our group enjoy using. Number one, the scanning is very quick and precise. It allows the patient to have their eyes open while scanning is being done in just a few seconds. Second of all, MetiSmile merges the intraoral jaw file with the facial scan seamlessly by using the AI feature, and that's really a plus for us. Very often patients ask us, why are we scanning the face? We tell them, with the modern technology, we can now design a smile that fits your face. Printing model is actually a super easy process. After we scan the jaw, we can just generate a model and send it directly to the printer to be printed. But with the shining printer, after printing, we can take it directly to the wash machine, which will cut and clean for us. And then we can take it direct to the cure to be processed with ease. There are a couple of things we like about this printer. Number one, it's cost effective. Number two, it's an open system, so I can select the type of resin that I like to use. The profiles are already there. Number three, with their cloud system, I can control the printer at the comfort of my home. Okay, I think the engineers in Shining are doing an excellent job. Their products, from the MetiSmile to the intraoral scanner to the printer, all communicate in a single platform. So as for me, I'm a 50-year-old dentist who's not very tech savvy. I don't know too much about computer and softwares as compared to the 20-year-old dentist who just graduated. What Shining provides for me is convenience. Especially with their platform and software, I can do exactly the same thing like what the younger dentists do with a click of a button.